A penile implant is an erection assistance device used in the treatment of erectile dysfunction, or ED. Now, a penile implant is placed inside the body during a surgical procedure, which in the majority of cases is an outpatient procedure. There are two main types of penile implants that are available, including inflatable penile implants such as the Titan implant from Coloplast, or the malleable penile implant such as the Genesis implant. Both types are completely hidden inside the body and create an erection at any time for any duration. Now, the most common implant is the 3-piece inflatable penile prosthesis. However, we will discuss which implant is best for you and your partner during your consultation together when you come to my office. The Titan inflatable penile implant is a 3-part fluid-filled system that is inflated to create an erection. Now, the 3 parts consist of a reservoir that is typically placed in the lower abdomen, and then 2 cylinders which are placed in the shaft of the penis, and then there's a pump located in the scrotum. The inflatable implant is designed to look, function, and even feels like a natural erection. It's completely contained inside the body, and to get an erection, you simply squeeze the pump, or your partner does so, in the scrotum, and each squeeze then moves some of the fluid stored in that reservoir in your abdomen to the 2 cylinders in the penile shaft of the penis. And as the cylinders fill with fluid, the penis then becomes fully erect, and you can keep this erection for as long as you and your partner desire. And when you no longer want the erection, you simply squeeze the deflate button on the penile pump in your scrotum, and your penis returns to its soft or flaccid state. For men who have trouble squeezing the pump, such as those with poor hand dexterity or limited strength or range of mobility, then a malleable penile implant may be the best option for you. And this implant consists of 2 flexible silicone semi-rigid rods, which are implanted in the penile shaft as well. With this device, when you want an erection, you simply position the penis up by bending the malleable prosthesis upwards. And when you no longer want erection, you simply bend the penis down, the implant moves to a downward position. Now, the Titan implant is made of silicone, a polyurethane, and a material called Bioflex that is safe for your body and is stronger than any silicone product alone. The Bioflex material is a unique material specifically engineered for penile implants to make them stronger and more durable compared to all the other penile implants on the market. The fluid that is stored in the reservoir of the penile implant is sterile saline solution. The saline is simply placed in the reservoir at the time of your surgical procedure, and it cycles through the system on demand without needing to be refilled. Frequently, I'm asked by patients, how long does the penile implant last? Well, the inflatable penile prosthesis is a device that has long-lasting solution for erectile dysfunction with an average lifespan of 75% of penile implants for about 10 years or more. In testing, the Titan implant was shown to last more than 6.5 million cycles without any breaking. In general, most men with erectile dysfunction may be very good candidates for the penile implant. Candidates can include men who have tried and failed other ED treatments, or those who've had prostate surgery or other treatments for prostate cancer. Good candidates for a penile implant may also be men with a pre-existing condition such as cardiovascular disease or maybe diabetes. These men may not be able to even take oral medications, or maybe the oral medications that are no longer as effective. You know, it's important to know that there's no requirement to try oral medication prior to moving forward with a penile prosthetic surgery. If you have poor dexterity in your hands, maybe you're not the best candidate for a penile implant that's inflatable, but maybe instead you're a good candidate for the malleable penile implant. Unfortunately, you may not be a good candidate for a penile implant if you have an active infection anywhere in your body, especially if it's in the urinary tract or the genital region. You're also not a good candidate if you're allergic to silicone or polyurethane. In addition, if you have problems with urination from bladder outlet obstruction or a neurogenic bladder, the penile implant is not an option for you until those concerns are resolved and addressed first. Despite the durability of a penile implant, you need to be mindful that the device may need to be replaced during your lifetime. If you prefer not to have a second surgery to restore erectile function, you probably shouldn't consider a penile implant. There are also some other considerations that we will discuss should you feel the malleable implant is the right treatment option for you. Please refer to the important safety information at the end of this video for these additional considerations. We understand that everyone's ED or erectile dysfunction treatment journey is a lot different than someone else's, and during your appointments together with me, we will discuss all these options and try to determine what's the best solution for you and your partner. The penile implant is custom fit to your existing anatomy at the time of the procedure for surgery, and it is intended to optimize the length of your penis. During the procedure, me or your surgeon will measure the total length of your erectile tissue and place an implant that is best fit for your size and for your anatomy. The implant fits alongside your existing anatomy, and one size does not fit all. Inflatable penile implants are an effective solution for erectile dysfunction and have a very high satisfaction rate for both you and your partner. A study of Titan penile implant patients reported about a 98% satisfaction rate, and to go along with this, their partners reported a 96% satisfaction rate. You know, like any other surgical treatment, there are potential risks and complications with a penile implant surgery. The risks include, but not limited to, device malfunction, such as a breakage or a leakage or maybe an infection, maybe an inflation difficulty, erosion, or maybe even incorrect sizing. Also, after a penile implant, it's no longer possible to have spontaneous or natural erections, and so most other ED treatments will no longer be effective. I'm frequently asked, can I still have an orgasm after a penile implant? Yes. If we're able to orgasm and climax and ejaculate before the implant is placed, these abilities should not be affected by the implant or by the procedure in any form or fashion. The inflatable penile implant is completely concealed inside the body. In the soft and non-erect state, the penis appears and feels completely natural. No one can tell that you have a penile implant. And because of its nature as a flexible rod, the malleable implant is a bit different though. The malleable stays firm when placed in the down position, so for this reason, it may be a little bit more visible than the three-piece inflatable penile prosthesis.